I loved in the book your own personal story around hair loss and some of the natural things that you did, and I would like to address that if we can, because I think what happens, particularly for the demographic that listens to this show, like we're in perimenopause, we're in menopause, the our hair is in many ways it's kind of like our crown, right? So and a lot of women, whether it's androgenic or there's sort of male pattern, female pattern hair loss, or just because of a change in our hormones and we're starting to get a lot of thinning, it can be relatively
Traumatic.
upsetting and
Yeah.
traumatic. Yeah.
Yeah.
So can you walk us through what are some of the options for women? You can talk about for men as well,
Yeah.
but what are some of the options that we might consider when we're thinking about a loss of volume? And then I know that there's different types of hair loss. We had Dr. Kyle Gillette on the show, so I'll link in the show notes that he talked a lot about specifically androgenic alopecia. But let's talk a little bit about hair loss and what some of our options are from a surgical perspective.
So yeah, from a non-surgical
Oh,
perspective.
non-surgical and then surgical. Sorry.
Yeah. So I mean, that's something that I myself have dealt with. Years ago, my wife and I, we were filling out this like couples thing. And it's like, what do you find most attractive about your partner? And she put his hair. And so we were in Jamaica, gosh, now it was maybe 2, 3 years ago, and we were cliff jumping, and I was at the top of the cliff, and my wife goes to me, because she was on a rock above me, and she's shorter than me, so she never sees the top of my head. She goes, "Oh my gosh, you're thinning on top." And I'm like, "What?" And I almost fell off the cliff because I was like, "No." So for me, I wanted to, I looked and I'm like, man, I do have thinning of my hair and I don't want to lose it. And so the things that I did are things that are very direct. They're very straightforward, and really anybody can do it. Obviously, if you've got thinning hair, the first thing you want to do is talk with a functional medicine practitioner. You want to get labs checked and stuff like that. But if you want to just tackle it on your own first, then this is what I would start with. Number one, stress. Okay. We can get something called telogen effluvium, where you get hair loss due to stress. So if you're in a very stressful time of your life, then obviously reducing that stress can potentially help. And I do put a lot in the book about meditation and yoga and gratitude and things like that. Short of stress and stuff like that, and getting more sleep and all of that, the first thing I would look at would be then taking a nutritional supplement. Now, there are certain nutritional supplements that are specifically made for people who have hair loss or thinning hair. Now, once again, you can see a functional medicine doctor. You can see if you've got an iron deficiency. You can see if you're deficient in vitamin D or zinc, which all of them can potentially create thinning hair. Or you can go and take, let's say, Nutrafol, which is the supplement of my choice, which basically has everything you need in it for thinning hair and for nutrient deficiencies. Now, Nutrafol has a men's version. They've got a women's version. They have a women's balance, which is for women who are perimenopausal and postmenopausal. Typically, it's 4 capsules a day. It can take 6 months or longer to really see results from it. But that's the first thing I would recommend taking, is a good hair loss supplement.
You did that as well. Did you do that?
I do. Yeah. And I'm still taking Nutrafol today.
Okay. Cool.
Yes.
Mm-hmm.
Second thing that I would do, completely non-invasive, would be to try red light therapy, or basically a laser helmet. There are helmets specifically made for thinning hair. The one that I have is called iRestore. It has like over 200 lasers in it. And essentially what it looks like is a helmet you put over your head. It's got all these lasers that will kind of target your follicles, and you wear it for about a half hour every other day. And the idea behind it is that the energy from those lasers get absorbed by your hair follicles, and it causes your hair to go into a growth phase. Okay. Instead of like the telogen, where it's a kind of a settling down phase where the hair is just kind of quiet, it causes more hair to go into a growth phase to essentially grow. This is very scientifically proven. There are a ton of studies in the literature showing that low light laser therapy does work for thinning hair. And so dermatologists, everybody would agree that this definitely works.
Is that like I have one from a company that I work with where I put it on my face and it's red light therapy. It looks like a Halloween mask. Is it the same kind of idea there?
It's a little bit different. So that is red light therapy. That definitely helps. And that is, if you're looking for bang for your buck for overall facial rejuvenation, 100% I recommend red light therapy devices. It is similar. The ones for the hair, though, are going to be more intense.
More intense. Okay. Mm-hmm.
Yeah. And that's technically more they call low light laser therapy versus red light. So the low light does have different wavelengths that will go, not just the red light therapy with like the mask that you use. Those I think are great though. And there are studies that do show that red light therapy devices can really help to rejuvenate your skin. But going back to hair, so you start with the Nutrafol, then you use the helmet, the laser helmet. I would then recommend some type of a oil or serum on your scalp. Now, traditionalists will say use Rogaine. Rogaine comes in men's and women's, although women can use men's strength technically. But there was a study, for those of you who want to go natural with it, there was a study comparing Rogaine/minoxidil, same thing, to topical rosemary oil, and found very similar results with thinning hair, except the topical rosemary oil did not create the irritation of the scalp that the minoxidil did. Now, you can actually buy formulations. Some people will get rosemary oil as an essential oil. You want to mix it with a carrier before you apply it to your scalp. Or you can buy commercially made ones that are they're already diluted down for you. But one of those would be an option. For me, lately, I've been using one. My old mentor in residency, he's got a company called Hair Prescriptives, and he has actually an oil serum or an oil. It's called his Akakshi oil that's filled with healthy fats. And that's what I've lately been using myself. So some type of a topical I do recommend. If you want to, before you do the topical, you can do some dermal stamping of that area. And some people, you may see people using dermal rollers over their beards and finding that that really helps the hair growth. So you can do dermal stamping. That's what I've been doing before I apply the actual oil. So that's really a very general way to start with thinning hair that is very easy, that's natural, that's non-invasive. The steps after that, now you do want to give it at least 6 months to see a result from it, but it does really help. There are other things that people can try. Some people wash their hair with rice water. Some people find that seems to help them. There's some people who use coconut oil on their hair. Some people even use castor oil. Really, all of those types of things, what you're doing is you're giving it healthy oils, you're giving it antioxidants, all that's healthy for the scalp, but no studies that I know of have shown any of those to actually proven to grow hair. Whereas the ones I'm recommending for you definitely have been proven scientifically.
With the minoxidil or the Rogaine versus the rosemary oil, is it, again, it's kind of the same question as the retinol versus the tretinoin. Is it the same frequency of application? Is it the same strength? Like, what are we, I know we're not comparing the same compounds, but how are they're comparable in terms of...
I don't recall the exact study as far as how often. I think with minoxidil, you apply that every day, like every night typically, but I don't recall exactly from the study. It was a relatively smaller study. And I think, when you're dealing with something like rosemary oil, it really, for me, when I put the oil on, I don't do it every day because I don't like oil in my hair every day, honestly.
Yeah.
It flattens out my hair. So really, I think you do it with something like rosemary oil, you do it really at whatever frequency you're comfortable with, because you can't necessarily overdo it because it's just rosemary oil. Minoxidil, I think, is probably once a day for what I know, but I'm not 100% sure on that.
All right. So we were Nutrafol, laser helmet, an oil or scalp serum, a dermal stamping. Was there any other steps after that, or that's like a general protocol for people?
If that's not working for you, then the next step would be to consider PRP injections. So now you're going invasive. PRP, platelet-rich plasma, where you draw your blood, you separate out the platelets. The platelets are chock full of growth factors. And if you inject that PRP, that substance, into the areas of your scalp with the thinning hair, there are many studies to show that can definitely help with hair growth. I have not gotten to that step yet. We do a lot of PRP in my office. I just haven't gotten to it yet because I've been kind of lazy.
You've followed this protocol. So the Nutrafol, the laser helmet, the scalp serum. How has that been working for you? Did you take before and after pictures? Have you seen that the thinning is improved? Like, what has been your experience?
Yes. Yeah, but it still is, I'd say I probably have about a 40% improvement. And
That's
it's still
huge.
something that, it's still something though that I'm not happy with yet. But it's kind of a constant thing. And so this is what I would recommend starting now. Yes, if I were to, I think, be less busy and at some point have my nurses inject PRP into my scalp, I probably would see even a better change with it. But yeah, I'm probably seeing about a 40%, maybe 50% improvement with that. And that's pretty consistent with what people see. I think you just have to be you have to start off and you have to be patient because it really will take 4 to 6 months to really see those changes.